Good afternoon, everyone. Welcome to a special edition of COVID and You. My name is Liz Charlotte. I am the Director of Communications at the Mississippi State Department of Health. This show is geared to all of you today, our K through 12 teachers, students, and administration. We treasure all of you, and we want to make sure that you get a chance to ask the questions you need answered. So we will start with Dr. Paul Byers, our state epidemiologist, and he will brief us on the latest numbers and data on the various vaccines. And then we will throw it to our state health officer, Dr. Thomas Dobbs, and he will discuss vaccines and classroom safety, among other things. Please feel free to ask questions via the chat feature. I will be monitoring that. I'm going to excuse myself and have our state epidemiologist take over while I move to moderate the session.
Hey, thanks everybody. And thanks, Liz. And I'm glad everybody has had an opportunity to join us today. We've had such a great relationship with K through 12 during this pandemic, and we certainly want to continue that, and are so pleased to have the opportunity to share additional information with y'all. I'm actually going to share my screen and see if we can show some slides, and hopefully everybody can see these. What I want to do is give a very brief epi update of where we stand with our cases and deaths and hospitalizations in the state, as well as some preliminary information about vaccine and our vaccination rates, and then turn it over to Dr. Dobbs. So today we're reporting out an additional 317 cases and 6 deaths. I know y'all have been paying close attention to the numbers that we report over on a daily basis, and you have seen some steady decreases in that, and we're especially pleased with the decreases in the number of deaths that we're seeing. If we look at our cases as they occur over time, you can see that we've had, after a very large peak over the holidays, starting just before Thanksgiving and continuing well into January and the early part of February, a very large surge in the number of cases in the state. This was seen nationally as well. And that was really our third large wave of activity. It's been just a year ago now where we were in the midst of our first wave of activity, followed by the very large increases that we saw over the summer prior to everybody returning back to school. We actually had a bit of a lull in activity before we head into a big surge in the holidays. But you've seen that we've had some steady declines in the overall incidence of cases in the state. We have had some leveling off a little bit, but are still trending somewhat downward. And we are averaging, over a 7-day average, about 350 to 400 cases a day. So significantly less than what we were experiencing before. If we look at our deaths, we've also seen some great downward trends in the overall number of deaths that we've seen. And we've seen a different impact on the deaths as well. Just to kind of set the stage, remember that it's our individuals who are older than 65 that are really at highest risk, and where we see most of our deaths and most of our hospitalizations in the state, and that's mirrored nationally as well. And we're really, when we look at the age group of even 50 and older, we see more than 90% of our deaths occurring in those individuals. We've had some steep drops in the impact on those individuals over the last several weeks. And you can see that we continue those declines now with a 7-day average of about 5 deaths a day. That's still 5 too many, but we continue to move in the right direction with the impact from COVID, even though we're still having some 300 to 400 cases a day. When we look at our hospitalizations over time, and this is actually a graph that goes back to the beginning of the pandemic, so that you can kind of see what the impact has been on our hospital settings. We reached a high of more than 1,400 confirmed cases of COVID-19 requiring hospitalization back in January. We've continued some steady declines since that time, and as of yesterday, have dropped below 250 actual confirmed cases in the hospital. At the same time, we've seen decreases in the severity of illness. In those patients who've been hospitalized, there's been less requirement for intensive care and less requirement for patients to be on ventilators. These are all good things, and we continue to hope to see those trends drop. If we look at the impact on our schools, we've seen very similar trends. We continue to have schools report to us on a weekly basis the number of new cases that are reported in teachers and staff, as well as the number of new outbreaks, but also some information on the total number of students that have required quarantine and the total number of teachers and staff and outbreaks since the beginning of the school session, starting back in January. You can see that we've continued to see some declines, and just on the latest report, only one outbreak was reported in a school setting of those 460 schools that reported, and we're seeing much less impact of new cases on students and on teachers. And so, this is not all schools reporting, but we continue to get high levels at schools. Largely, this has been impacted by the spring break holidays. We anticipate that number going up, but I encourage y'all to look at our website and look at the school data that we report. And if you haven't reported, we can get you the link for that reporting. I don't want to steal or impact what Dr. Dobbs is going to talk about, but I'll do a very brief update on where we are with vaccines in Mississippi. As y'all are aware now, the current eligibility for vaccination in Mississippi are individuals who live here or who work here who are 16 years of age and older. And a lot of that depends on the type of vaccine that's available. As of today, we have administered more than 1 million doses of vaccine in the state. We've seen this number increasing somewhere in the range of 25 to 30,000 additional vaccines administered on a daily basis. More than 700,000 Mississippians have received at least one dose of a vaccine. And we have over 400,000 people in the state who have been fully vaccinated. These are great numbers, and we expect to continue to see those numbers improve over time. When you look at our doses administered by racial breakdown, we have, and these are total doses administered in the state, more than 29% of our total doses have gone to African Americans in the state. 63% have gone to white individuals. I would encourage y'all as well to look at our website for our vaccine data, and we continue to add to this data on a routine basis to include now vaccine rates by county for first and complete or fully vaccinated individuals. So I encourage y'all to look at it, look at your county, see where y'all stand. We've made some great strides in vaccinating our individuals 50 and older. We'll look at that in just a second. But you can see the numbers of vaccines that we administer on a weekly basis. And in Mississippi, we've managed to vaccinate somewhere in the range of 130,000 folks on a weekly basis. Those numbers have dropped a little bit, but if you look at this week, we expect that this is going to increase some more. And you can see the vaccinations that have been given by the type of vaccine as well. When we look at our age groups, and certainly the 50 and older are where we've seen a very large impact in the vaccinations, and where we've seen a large impact in the impact of COVID-19. So for those folks 50 and older, we have vaccinated More than 48% of our Mississippi residents have had at least one dose. 61% of our individuals 65 and older have had at least one dose, and 62% of our 75 and older have had at least one dose. And so that's great progress, but we have more work to do. I encourage everybody, and remember that individuals 16 years of age and older are now eligible. That means that all of y'all are eligible for vaccine. If you haven't gotten it yet, I encourage you to do it. And look at our website. We have a vaccine finder that is specific for Mississippi providers in the state. It's interactive. When you first pull it up, you see all of the types of providers listed. If you click on one of those, and what I've clicked on here is one of our drive-through sites that we have over 24 locations in Mississippi. It tells you the location, what type of provider it is, the address, how to make an appointment, either through phone and calling our hotline or going on our website and directly making that appointment. So I encourage all of you, if you have not been vaccinated yet, take the opportunity. We've seen that the vaccinations in our older population is really starting to have a significant impact on the severity of illness. And so that I'm going to turn it over to Dr. Dobbs now, and he'll fill us in on a bit of the details about vaccine.
Hey, thank you so much, Dr. Byers, and always great information. It's exciting to see that we're making progress in the fight against COVID, but we have a little bit of work to do. So please, we want you to continue working with us. And I'd like to start off by thanking you all for your fantastic work, educating our kids, making sure that they can do it safely and effectively, either virtually as we continue to get kids more and more to the classroom and understanding how safe that can be now. Vaccination is going to be a critical piece of that equation. I want to spend a little bit of time talking about the vaccine specifically. And this is something that we want to make sure that you guys have an opportunity to understand some of the fundamental basics of the different COVID vaccines and to really give everybody a chance to ask questions. One of the things that we found is that, people sometimes have questions. Sometimes people even have skepticism, and that's healthy and that's normal. But by and large, we found that when people have a chance to ask questions and get answers and links to information, that there's a lot more comfort and a lot more familiarity and excitement about getting the COVID vaccine. So I'm going to talk a little bit about the COVID virus itself, and we're just going to do a quick little biology class. And this is sort of a graphic model of the COVID virus, and you can see that it's a single-stranded messenger RNA virus, or really just an RNA virus. And then on the surface of this virus, it has these things called the spike proteins. And these are these little red protrusions you see. And this is going to be very important for our vaccine story that we're going to tell. The spike protein is the mechanism that the coronavirus uses to gain entry to the cell. It connects to the thing called the ACE2 receptor, and then it gets into the cell. And when it gets into the cell, it extrudes its viral ribonucleic acid, RNA, and then this RNA uses the cell's own machinery to reproduce itself. It makes proteins and it reproduces the RNA, so then it can release new coronaviruses, new COVID-19 viruses that can go out into the body and either infect new cells or to go out into the environment and infect new people. So let's do a quick conversation about the immune system and what an important role that plays in our health and well-being. When we're exposed to a germ, the germ will attack our system, it'll attack our cells, and it makes us sick. And we feel really bad. And sometimes if the germ is aggressive enough, or if the body is unable to fight it off, we can have severe issues like hospitalization and death. And certainly we've seen a lot of that with COVID, without a doubt. But we have immune cells. The body can fight back. And these immune cells will analyze the germ and generate an immune response. It'll generate several different components, but the big two that we think about a lot of times in relation to vaccinations especially are going to be B cells, which produce antibodies, and then T cells, which is the cell-mediated immunity that you may have heard about. And having that complement of B cell immunity and T cell immunity gives your body a real fighting chance so that if you're exposed to it, you can protect yourself. So after the infection is resolved, your body creates these memory cells that are then sitting around waiting to eradicate the germ if you're exposed to it again. And this is usually specific for a single germ, right? So if you're exposed to one germ, you're protected later on, like with measles or something like that. Well, the good thing is about a vaccine, if we got the right kind of vaccine, we can give it to somebody and it triggers the immune cells without making people sick. And it teaches your body how to make B cells and how to make T cells so that if you're exposed to the germ for real, these immune memory cells are able to activate, clean out the germ before it makes you sick at all, and then you don't feel bad at all. You don't reproduce enough virus to be contagious, and certainly not enough to make you ill. And that's really the beauty about vaccines. You train your body, you train your immune system to fight off the germ without having to go through the illness that is associated with that germ, that bacteria, that virus. And obviously, in this case, we're talking about COVID-19. We do have numerous vaccines now available, but they've been through extensive testing and analysis. One of the things that I think is very important is to really emphasize the extensive studies that have taken place for the COVID vaccines. We were very fortunate in that, especially for these mRNA vaccines, the Moderna and the Pfizer type products, that the technology that went behind them was something that was over a decade in the making. They were actually building these vaccines so that they would be ready for other illnesses. And the technology for these vaccines is such that it's very translatable into new and evolving infections. So a decade of research went in to basically to get us at the starting point. So we actually was started at the starting line without having to go through some of this basic science where we could go ahead and go through these extensive phase 1, phase 2, and phase 3 trials. If we look at the typical vaccine studies, and we know this happened for the Pfizer, the Moderna, and the Johnson & Johnson, you'll go through phases. You'll have a phase 1, 2, and 3 that gradually ramp up. You start off with a small number of people, making sure it's a proof of concept, that it's safe, there's nothing unexpected. And if that looks good, you go to a phase 2. And if that's still looking good, you go to phase 3 into the general population. And you see, how does it perform in real world scenarios? And when we're looking at the vaccines we're talking about, we're talking 30 and 40,000 enrolled subjects, which is a large number for a clinical trial, right? It's a very big number, and it's very consistent with other vaccines. So there's nothing really on the shortcut end for that. It's just that we did something pretty innovative. Instead of doing things sequentially, such as like the trial, and then you wait for a while, and then you do the manufacturing, and then you wait for a while, and you do the FDA approval. We tried to do them as sequentially as we could, especially the trials and the manufacturing. And part of the federal government's innovation in this is they agreed to buy vaccines whether they worked or not. And a lot of vaccines have been abandoned. It's not that everything that went through was accepted, but that way you don't have to wait for it to be manufactured. You actually have a bunch of it sitting there ready to go if in fact it proves to be promising. And fortunately, we have several very promising and highly effective vaccines available to us. I want to just go a little bit over the mechanism that mRNA viruses use to protect you. The Moderna and the Pfizer vaccine are these things we call messenger RNA vaccines. And what they are, it's a little bitty snippet of messenger RNA. Remember we talked about how, the coronavirus has its own little RNA? Well, what they did, which was very clever, instead of they're not giving you the whole RNA, they're just giving you a little bit of the messenger RNA for the spike protein. So it trains your body how to make a little bit of the spike protein so that your body can then generate that immune response. And so if you recognize that you've been exposed to coronavirus, your immune system can wipe it out. You can't get coronavirus from the mRNA vaccines because it doesn't have, a full genetic complement. It's just going to be the spike protein. The other thing is your body naturally degrades messenger RNA. I've heard people asking about that. Your body degrades messenger RNA all day long. That's what it does as your cells use this as a tool for its normal day-to-day operation. So it's nothing that's going to accumulate. And we've seen that this is highly effective at producing immune responses. One of the things I want to mention is this lipid nanoparticle thing. And that's been something, I think the nano word kind of got people kind of freaked out a little bit. And all it is it's a piece of this messenger RNA, and it's surrounded by a lipid nanoparticle, which means a very small ball of fat. And the ball of fat is just lipids. It's like some of it's cholesterol and some other sort of normal sort of fatty molecules that your body would normally be exposed to, and just a microscopic amount of a preservative material that is typical of other medications, vaccines, et cetera. Nothing that is worrisome. The other one that I think it's important to talk about are these viral vector vaccines. And it's just a different way of delivering the genetic material. The viral vector vaccines, especially the Johnson & Johnson, or it's also can be called the Janssen because the two companies work together to make this vaccine, they basically take what would be considered a benign cold virus, and they put within it, instead of the cold virus genetic material, they put in a short segment of DNA that codes for the spike protein. And instead of using the lipid nanoparticle, you're basically using this sort of shell from a benign cold virus. There's no cold virus in there, it's just the shell. And this is the way that it delivers this genetic material to your body so that you can learn how to fight off the spike protein and then again, be immune to coronavirus. If we can compare the vaccines, I did loop the Pfizer and the Moderna together. They're both messenger RNA vaccines, and they have really comparable performance characteristics. We see that their efficacy is really pretty much identical. If we look at the big differences that we see between the Moderna and the Moderna Pfizer, and then also the Johnson & Johnson, the immediate difference you see is the number of shots. If you get the Pfizer or the Moderna shot, you have to get 2 shots. For the Pfizer, you get 1 shot, and then you get a second shot 3 to 6 weeks later. And for the Moderna, you get 1 shot and a second shot 4 to 6 weeks later. We know that you really want to be 2 weeks after that second shot to feel like you've gotten the full impact of the immune response. Johnson & Johnson is a single shot vaccine, which is extremely appealing. And certainly you want to have had it for a couple of weeks before you feel like you're going to have your full impact. But there are some differences. One of the great things is we see that the efficacy of both these vaccines against severe illness leading to hospitalization or death approaches 100%. So that's really wonderful. The main thing that we want to prevent is people getting really sick or dying, right? So these both look good. But it is worth acknowledging that the Pfizer and the Moderna, if we look at the efficacy at preventing any symptomatic illness, it is a little bit better, around 95% for both the Pfizer and the Moderna, and around 70% for Johnson & Johnson. So there is a bit of a trade-off. But obviously the benefit for the Johnson & Johnson is going to be the single shot and you're done. And it's proven to be very, very popular. But Pfizer and Moderna, obviously very popular. We did a vaccination effort at the downtown for state employees, and we gave them a choice between Pfizer, Moderna, and Johnson & Johnson, and did this same sort of explanation of the efficacy and how they work and the same sort of information. And 2/3 essentially chose Pfizer and Moderna, and 1/3 chose Johnson & Johnson. Side effects. Many have 0 side effects, except for maybe a little soreness at the injection site for all of these vaccines. I received the Pfizer vaccine and I had 0 symptoms. I'll let Dr. Byer speak for himself, but I know he said before that he just had just the littlest bit of maybe achiness and fatigue after the second shot. The primary side effects are going to be you might feel a little bit achy or fatigued for 12 to 24 hours. That is temporary. That can be a little bit worse for some people than others. A lot of times it's really minimal. And again, a lot of times it's 0, as I mentioned. What we have seen is it might be a little bit worse after the second shot for the Moderna and the Pfizer, and that was seen in the studies, but again, nothing that was identified as too serious. But we have seen if folks have had COVID before, so they have been diagnosed with COVID, and then they get either one of these shots, that the inflammatory reaction can be a little bit more intense, which kind of makes sense because what's happening when you start having these symptoms, this sort of achiness or even low-grade fever, it's that your immune system is being activated. And it's those immune system chemicals that make you feel this way. It's not the virus or anything like that. And if you've had COVID before, your body's already pre-primed to respond to the vaccine. And so we have seen some of that. Very rarely have they seen anaphylaxis at a rate of about 2 per million. And this is really only among those with known anaphylaxis. And we haven't seen any deaths that we're aware of. And we haven't seen any anaphylaxis episodes that I'm aware of in the state of Mississippi. We've had some very mild reactions, like a little bit of skin rash or something, but everything that I've seen so far has responded quite nicely to a little bit of Benadryl and a little bit of rest and time. So why take the COVID vaccine? One of the things we want to do is make sure people understand why it's so important. Well, if you're 50 and older or have any medical issues, there is a significant risk of death or hospitalization. And if we look at where people have died, make no mistake, about 7,000 Mississippians, and probably more based on reporting lapses, have died who would not otherwise be dead in Mississippi. 500,000 people in the country, in our country, have died from COVID who did not have to die. We see it's higher in people who are over 65, but it's a significant number of people are also over 50. But even though it's more in this age group, we still see quite a number of deaths in older and younger age groups too. So that is, very significant. And if we compare this to influenza, it's really remarkably higher. It's about tenfold higher than we would see with influenza for any age group. So much, much worse, much more worrisome. But why would I take the COVID vaccine if I'm young and healthy? Well, there's a lot of reasons. Obviously, we know there's a risk of death and hospitalization, although it's smaller. And my wife is a critical care doctor, and she's had a lot of young, healthy people, even young, healthy people who've passed away, who didn't think that they were at risk. So if you're one of those, 1 in 500, 1 in 1,000 people gets COVID who's going to die and you're young, it's 100% for you. So again, not worth the risk. You can prevent COVID. It can make you really ill. And I've talked to people who've had COVID and had the COVID vaccine, and they'll say, yeah, the COVID vaccine did make me feel kind of achy, but it was 1/1000th of my experience of being sick at home for a week or 2 weeks with COVID. So it can make you really sick, even if it doesn't make you deadly ill. Protect your family, especially people who are vulnerable. But we also see that we've seen kids die, and we'll probably see more of that. Young folks, especially with that MIS-C, there's like a thing that kids get that they get inflammatory and will die. And most of these kids who died were healthy. It's not like it's somebody who was likely to die in the near future anyway. So protect your family, protect your kids, and protect your cousins, your grandparents, your aunts and uncles, everybody from getting COVID. You can avoid quarantine if you're exposed. Right now, CDC has guidance that if you are vaccinated and you're exposed to somebody with COVID, then you don't have to quarantine for 10 days or 2 weeks. So that's another benefit. Stop transmission in the community. We all want to drive this down, and if we can quit having transmission in the community, we can do more great, wonderful things that we want to do, the things that make life worth living. And other things that you think about, it will improve your safety with travel. We anticipate that we'll probably see more and more sort of guidelines or restrictions around travel and other activities, whether or not you've been vaccinated. Also, prevent long COVID. We know that a significant minority, 15 or 20%, will have long COVID. And I was just talking with some folks at UMC today who were seeing patients with like a long COVID clinic. It can be anything from chronic lung problems. It can be fatigue, depression. NPR had a story about a guy who developed paranoid schizophrenia, and it really was debilitating. So there are other sort of strange things that can happen that are worrisome that we don't really have a good understanding of, that we'll have to see how these evolve over time. The same sort of weird stuff did happen after the flu pandemic of 1918, where they had weird sort of like changes, especially neurologic changes after the 1918 flu pandemic. And we may get a better sense of what those strange things are, but you don't want long COVID either. So it's very important for you to get the COVID vaccine, even if you're young and healthy. All right, so want to go over a couple of COVID related myths, and just want to take another opportunity to explain and share why I think it's a very good reason to not get your news from Facebook, because people get more information than good information from Facebook. I hate to say it. Starting with number one, that Facebook nonsense. COVID vaccine has killed a bunch of older people. Is that true or not true? It is absolutely not true. CDC looked at this very closely, and when you give vaccines to over 100 million Americans, or actually it's 100 million doses have been given, and over 80 million Americans, a small proportion of those, especially if you give it to older folks, may have something bad happen within the next week or two. And what they found is, yes, some people did have heart attacks or stroke or something in the week or two after the vaccine, but guess what? It's at the same rate that it happened for everybody else. So it's just random chance. And of course, because people are quick to draw assumptions, people get scared, but that has not had any link to any deaths thus far. This is one that's very scary and insidious because it makes people really worried, can cause infertility. False. American College of OBGYNs very strongly says that this is not true. This is a quote from their website and their publications. Unfounded claims linking COVID-19 vaccine to infertility have been scientifically disproven. It does not cause infertility, which is fantastic news. But there's also no reason, from a biological perspective, to expect that it would. It's just one of these sort of alarm things that sometimes folks like to buy into, and certainly it's good fodder for anti-vaccine type mindset folks. But it's just not true. This is a fun one, and I think we all believe it, but the crazy stuff people say that COVID vaccine have microchips, absolutely false. There's an interesting reason why, well, there's reason people start talking about it is because of Facebook nonsense, but just totally, absolutely false, not remotely true. COVID vaccine was developed too fast. I really don't think that's true. Extensively studied. We just spent a lot of time working on it, and we also, instead of doing things, it's like if you have 5 bricks, you can line up the 5 bricks in different ways. You can line them up in order, 1, 2, 3, 4, 5, or you can stack them up on top of each other. And that's a lot of what we did instead of doing the bricks in order. And a lot of that's business reasons, right? Because companies don't want to develop a vaccine that's not going to have a market, but because the government wants the market and said, hey, we'll take all the financial risk, they just stacked those bricks on top so that we could collapse that time frame. So the parts of the length of the bricks is the same, but the collective length of all the bricks is shorter because they did the things at the same time instead of in sequence. And the other one is, and I've heard this is a lot too, is I just want to wait and see what happens with others before I get the COVID vaccine. We've given over 80 million people have received COVID vaccine in the United States. If you haven't had COVID vaccine yet, it is now your time, so please don't wait. Now's the time to do it. Now's the time we can beat COVID in the ground. Now's the time that you can protect your family. Now's the time that we want to prevent rebounds. So, we haven't seen anything unexpected with the COVID vaccine, and we know from other vaccines that if something is going to happen, even though it's extremely rare, we will almost always see it within 6 weeks of someone getting a vaccine. And certainly we've been into this for 4 months now and haven't seen really any of that, not to mention all the people who've been in the studies. Where to get vaccinated? There's multiple opportunities. covidvaccine.umc.edu. You can sign up to go to a drive-through, or there's also a phone number you can call. That's most of the vaccine, or about half of it in the state's been given through our drive-through locations, but also your local doctor and hospital. About half the vaccines have been going to doctors and hospitals recently, also community health centers. We have hundreds of partners that have received vaccine in your community. So please look. Locations that do have it are on our website. A lot, the ones that are active in the pharmacies are on our interactive map. But we also have a list on healthyms.com that'll tell you which ones have gotten it. And certainly we have special events. We're working more and more to have church locations to give vaccines. One of our partners are starting to vaccinate folks at work, at schools, and we've launched an effort called the Center of Excellence Program, where different hospital health systems have taken on the responsibility of doing public vaccinations, providing COVID treatments for outpatients, and also to do outreach to make sure that the community is well taken care of. And very many of them have adopted schools as a location for vaccination clinics. So if you are a school and you want to have a vaccination clinic at your school, please go to our website and look for your local Center of Excellence. We have about 45 of them now that have enrolled, and it's on our list, and it's the COVID Center of Excellence program, and those folks can help you. That's all I have in slides right now. I do want to mention that we will be providing additional guidance on what to do with school safety, especially as we look at prom and other things like that. We do think there may be opportunities with vaccination, a combination of vaccination and maybe testing, that we could do some more social activities as we get further into the spring, but more of that's coming. Dr. Byers and his team will continue to update their guidance for schools that is on our website, and I know we have been sharing that with you on a regular basis. So right now, I will stop with what I'm saying, and I'd love to take some questions. And Liz, I'll turn it over to you to read the questions.
Thank you, Dr. Dobbs. We appreciate your comments. We have a lot of questions. We have over 300 people watching this, which we're very gratified to know. So some of you were sending questions to me privately. Please send them to everyone, but I'm going to try to juggle both. The first question is from Lisa Wilson. Many educators feel that the data is not being reported accurately. Is there any mandatory reporting measures in place or any repercussions for not reporting correctly?
And Paul, I don't know if they're talking about the school cases, you think?
I'm thinking that maybe they're talking about the school data. there are lots of different data reporting mechanisms. And, we have set up really since the beginning of school last August, a methodology for schools to be able to report those data elements that we looked at and presented a little bit earlier. There is a statewide health officer's order that does mandate that schools will report to us on a weekly basis. So it is a mandatory reporting system. If you're not reporting now, we ask you to do it. We can provide you with the link for our weekly survey. But we do have an expectation that gets reported to us. We have about 1,200 schools in the state, and we are getting somewhere in the neighborhood, typically, apart from holidays and spring break sort of things, about 800 schools plus that are reporting to us with regularity. And I have to tell you that, one of the things that we do periodically is communicate with the schools when we see that something doesn't look quite right, or if maybe a number looks like it's probably higher than it should be. And in fact, we do work individually with the schools to make sure that we get that data and that it's reported as accurately as possible. But at the same token, we rely on the schools to be able to provide that information to us, and it's vital at this point.
And I will say that it is a mandatory order for school to report, not that they're following the rules, but if anything bad happens, I do want you to know that there are potential legal issues for not complying with state health officer orders. So it is a mandate. It's not an option.
Thank you, gentlemen. The next question is there any sense or way of knowing what percentage of teachers have been vaccinated so far? Dr. Byers, do we know that?
Yeah, that's a little bit harder because our vaccine information registry doesn't necessarily collect that information about whether or not teachers have been vaccinated. So we don't have that readily available at this point. We're working on different methodologies to be able to look at that and get a better look at and be able to report some of those numbers. And certainly that's some information we're collecting in our drive-through sites, and we're going to be looking at that data as well.
All right. The next question, thank you, Dr. Byers, is from Mrs. Gines. I'm in Washington County and have not been able to schedule an appointment for my 16-year-old to get the Pfizer vaccine in my county. Will Washington County get the Pfizer vaccine? Gentlemen?
Paul, I guess they're probably still a Moderna site.
We're switching a lot of our sites over. Yeah, go ahead, Dr.
No, but yeah, please, that was my same thing, yeah.
So if you can't get it in Washington County, and we're hoping to be able to have Pfizer available in all our drive-through sites, and if you call our hotline, the operators should be able to help direct you to a site that does have Pfizer, where you can get your 16-year-old vaccinated, and in an effort to make sure that that's broadly available across the board. We're working on getting our sites transitioned over to Pfizer so we can do the 16-year-old.
I think those were all the direct messages. Our next question is from Ms. Rebecca Deloach. If I've already had the virus, is it necessary to be vaccinated? Yes. Dr. Dobbs, Dr. Byers.
Yeah, yes, certainly we do recommend that you get vaccinated. CDC does say that you can wait 90 days if you want to, but you don't have to. You don't have to wait 90 days. We do know that that people can get reinfected later on with COVID. So you basically want an immune boost from the vaccine. So if you've had COVID before, we do recommend you go ahead and get one of the other vaccines, and just need to make sure that you're recovered from COVID, probably a couple of weeks. But beyond that, please go ahead and get vaccinated.
All right, Mr. Alice, let's see, is there any recent data or information about new variants in Mississippi?
Yes,
Yeah,
on our website too. Paul, give us an update.
Yeah, so we have broadened our surveillance to be able to identify um, more of the variant strains that might be being transmitted in Mississippi or might be imported into Mississippi through travelers. We've identified out that we've reported about 25 different cases that have been infected with a known variant of concern in the state. The majority of those are the UK variant, and we have identified at least one South African variant, an individual who had contact with somebody who had recently traveled to South Africa. And so, we anticipate that we're going to identify more variant cases in Mississippi. That's why we're doing our surveillance and increasing our ability to sequence those viruses that we do detect, so we can identify if we have variants in the state. So stay tuned. We report that. We update it weekly on our website, and we do anticipate identification of additional variant strains in the state.
And we're very fortunate that the vaccines do protect against the new strand, correct?
By and large, it looks like the vaccine, so of the different strains that we've seen, so the UK variant, it seems like it's more contagious and possibly more deadly, but the vaccine looks like it has, pretty strong power. It's still protective against it, similar to the, the normal strains we're seeing. The uh, the South African variant is a little bit more troublesome in the sense of, yes, it's probably a little bit more contagious, but the vaccine is not going to be quite as good. It's pretty good. It's looking about 50% for any illness, and a lot better, 70, 80% for severe illness. So it's beneficial, but not quite as strong. But you do have residual crossover immunity for all the strains so far.
Dr. Dobbs, we have a couple questions, and I think it's important to talk about those that are of reproductive age. Is the vaccine safe for expecting mothers? What about those that are of the reproductive age? Can you talk a little bit about that?
Yeah, so on the reproductive age bit, there's nothing to say that there's any infertility concern. And as I mentioned, ACOG said that all that stuff has been debunked and there is no risk of infertility. As far as for being pregnant, a lot of women did get the vaccine in the studies, right? A lot of reproductive age women, and one of them was my daughter-in-law, right? So just or my son's fiance. So the other thing is pregnant women. So they didn't study pregnant women in studies, but a lot of pregnant women did get the vaccine anyway because they got pregnant, kind of at the window zone, probably when they didn't know they were pregnant, and they did fine. And it's certainly recommended that pregnant women can get vaccinated. We do recommend that they consider talking to their obstetrician, but it's not necessary. It's always good to have open conversation. But if you're lactating, pregnant, reproductive age, we have really good evidence of absolute safety, just like for everybody else.
And I think on the flip side of that too, Dr. Bob, is that there is, although small, there is a risk of increased severity of illness among pregnant women. So, I think the better path is to get vaccinated, and my daughter is pregnant, and she got the vaccine. So.
Thank you to both of you, both with personal stories. We have a question. Will it be mandatory for teachers to get the vaccine?
We don't anticipate that that's going to be a mandatory thing. I mean, it's really for your benefit more than anyone else, and certainly if you're around folks. So at this point, we don't anticipate that being a mandatory vaccine.
Okay, but we do recommend taking it for
Oh
sure.
yeah, absolutely. Yeah.
Okay, now we kind of answered this already. Do I have to wait? This is from Miss Lana Alvarado. Do I have to wait 2 weeks or 90 days after I had COVID to get the vaccine? Is 2 weeks the earliest time they can do that, or is it when they're symptom free?
Yeah.
Dr. Byers?
So really, it's once you're over the acute infection, and that's usually about 10 days from when you first got sick. So So if you're past that window, certainly if you're 14 days past when you first got sick, you should be easily able to take the vaccine. You don't really have to wait the 90 days. The 90-day piece came from the fact that once somebody is infected, there's good evidence that they're going to be protected against reinfection for at least 90 days after that acute infection, and that if the vaccine is scarce, if it's hard to come by, that those individuals could delay vaccination until later. But you don't have to, and as a matter of fact, I don't recommend you do that. If you're out of the acute infection, I recommend not waiting the 90 days. If you have an opportunity to get vaccinated, go and do it.
Thank you, Dr. Byers. From Mr. Ellis, what is the component or components in the vaccine that has or have caused anaphylactic reactions?
What they think part of it may be is polyethylene glycol, which is a common additive for all sorts of medicines, including, I don't know that they have it pinned down precisely, but they do say if you've had a history of anaphylaxis to an injected medication, you need to take special precautions. If you've had anaphylaxis to injected medication, we don't want to do an immunization at the drive-through site. We want you to be in a clinical setting and talk it over with your doctor. That is one of the things that they think that it could be, but I don't know that that we know absolutely for certain. But again, it is exceedingly rare.
Okay, Dr. Byers, since the vaccine does not keep you from catching COVID-19, how does that affect herd immunity? Now, my understanding is that both Moderna and Pfizer help limit transmission. Is that not true?
Boy, yeah, that's a great point. So it's been shown now that even with those asymptomatic infections, that both Pfizer and Moderna actually limit asymptomatic transmission, and I think we've seen the same thing with the Johnson & Johnson vaccine. And so in fact, even if somebody doesn't become clinically ill after becoming vaccinated, if they are infected, it's going to be a very minimal infection, and the chances of transmitting that are very minimal. So I think that in the efforts, and we've already seen, I think, the beginnings of the impact of getting high numbers of individuals vaccinated, and how that has impacted not only rates of transmission but levels of severe infection and severe outcomes. So we're approaching 65% of our 75-year-olds with at least one dose. And we know that even with one dose, you get some substantial protection. And so the more we move to getting everybody vaccinated, the better protected we're going to be all the way around, with our greatest chances of limiting transmission, but also reducing the impact of those cases that do occur.
Okay,
Dr.
guys,
Dobbs, anything to add on that?
Yeah, no, and I think the nursing homes are a good demonstration of that. We have seen a phenomenal improvement in our nursing home cases and deaths, and we've still seen some, but we'd still test. A lot of places they're going to be doing regular testing, and it's not like we've seen these sort of silent outbreaks, right? It's like it's not spreading around and nobody's sick. They're just not getting it at all. Early on there wasn't the data to support that, but I think over time the data is accumulating as we would have expected, but didn't know for sure that yes, in fact, the vaccine does also prevent asymptomatic infection.
thank you, and I didn't mean to interrupt you guys. This next question is very interesting. What are the COVID variants compared and contrasted to the original COVID? So how are they different from the original COVID-19?
Well, the UK strain is easy because it has a genetic manipulation on the binding region of the spike protein, so that it sticks to the ACE receptor more tightly. And so with that, it's more likely to be contagious, and you just have to have a smaller inoculum, lower number of viruses to make you infected, because it's going to hook more tightly. They're pretty much the ones we've been looking at are variants of it's just different genetic changes on the spike protein. And there are several that have been seen, and there's a different one also for the UK that it looks like it might be a little bit more contagious, though not the South African more contagious, but not more deadly. But it just through sort of just random processes, especially for the Johnson & Johnson and Pfizer, where they did some of the clinical trials down there, it does have some impact on the efficacy of the vaccines, of those two vaccines.
And there's lots of different genetic variations that are going to be detected over time because these viruses do change. They do have point mutations that cause a little bit of a change, but it doesn't necessarily lead to a change that's going to impact how it's transmitted or severity of illness or the impact on the vaccine or on the medications that are used to treat COVID. And so, one of the things that we do is we monitor and we look for those changes, not only to determine are we seeing something that's more predominant, but are we also seeing something that is spread more easily, and that predominance or that increased incidence can be an indication of that. CDC has a pretty good breakdown on their website of the different variants and sort of what their impact is and what their characteristics are about whether or not their increased transmission or what impact they have on the vaccine or what impact they have on the medications or those monoclonal antibodies that are used to treat COVID-19. And they have it broken down sort of in several categories. And so I would encourage you to look at CDC's website on COVID-19 variants. It's actually a pretty good little snapshot and gives you just enough information to kind of get an understanding of the difference between those variants.
Okay, gentlemen, thank you. Let's see, this is a direct to me, and Dr. Dobbs, you did chat about this a little bit, but maybe you want to expound on it. Any guidance for graduation prom, even as teachers get the shots, are masks and distancing here for the rest of the school year? Will any mitigation be necessary next school year? Dr. Dobbs.
Yeah, any mitigation next school year is a good question. And I think that really depends on, do we see anything strange from the variants, right? So if we're looking at the current variants, I think that we'll be able to be more open, especially if we're looking at vaccines for kids, if they come available over the summer. I think that's going to be key. So there's a couple of key variables there that are unclear. Going through the rest of the year, I think that we're going to feel more and more comfortable with outdoor events, especially as we have our vulnerable folks more protected. I think that there can be some planning starting for outdoor graduations for sure. Indoor events, we're going to talk more and more about how do you do it safely. Like, kids 16 and older can get the vaccine. So if you have a prom, if kids are vaccinated or test negative or preferably all vaccinated, it could be a much safer event. So we're going to work on some guidance for that. We haven't got anything from CDC on that, but we understand there's significant interest. But I do think that, and Dr. Byers, I haven't gotten that too much, but outdoor, some more normal-ish outdoor graduations seem quite plausible.
Dr. Byers, did you want to comment on that?
No, I think Dr. Dobbs covered it, and it's really hard to predict on where we're going to be for next year. But certainly, vaccination's the key, man. Get vaccinated now if you can.
Well, this writer says, you said that we have seen children die from COVID. Where can we find these numbers? Were these children enrolled in school in Mississippi, Dr. Byers?
So the numbers for the COVID-related deaths in children 18 years of age and under are actually published on our website. And we've been fortunate that we've only had a very small number of deaths. And at least a couple of those were in children who were not even school-aged children. I think we've had 1 or 2 deaths in school-aged children, and those were much earlier on in the pandemic, I think even before we started back to school. And so these were not necessarily children that were enrolled in a Mississippi school at the time. But it is one of the unfortunate things that do occur with COVID-19 infection, and though the impact is significantly less severe in kids, we do see some kids that have some severe illness. And remember, that even though we haven't seen a lot of deaths in kids, we have had cases of multisystem inflammatory syndrome, which can make children very ill and require hospitalization and sometimes a prolonged recovery period.
Okay, thank you. This is a good question. And by the way, for those others of you on the phone that are not K through 12 teachers, we're not taking any questions from the media. Let's see, will we have to be vaccinated every year like the flu shot? That's an interesting question.
You know, it's hard to know. COVID's different than the flu, so I don't think that we would expect to have the same sort of seasonality sort of thing. Obviously, COVID is not just like a wintertime predominant illness. Uh, I think what is more likely is if we get a new variant that we need a booster, that would be plausible. I'm not even sure that's going to be needed. So I don't think it'll be like the flu. If we get variants that are particularly worrisome, we might have a more like a booster phenomenon. I think that might be better. But again, it's still sort of speculative, but sort of like a regular seasonal flu shot. I don't suspect that we're going to have that.
All right, Dr. Dobbs, Dr. Byers, what's the source on the statistics provided about reactions?
Yeah, there's a lot of stuff. You know, I tried to put some links in my slides, but you won't have them. So CDC has a ton of stuff on the death piece. That was an MMWR from CDC that looked at, deaths among recipients in the public and didn't see anything that was linked to the vaccine. As far as like the side effects go, certainly there are some monitoring that happens by CDC afterwards, and there are some information published, but you can very clearly go on FDA has a lot of data for Moderna, Pfizer, Johnson and Johnson, and you can look at the tables, the graphs, and everything. It's about an 80-page report for both vaccines, and you can look at the numbers of people who had what type of reaction, with what frequency, and by age group and that sort of thing. So it's all out there, but I think between CDC and FDA, you could find most of what you're looking for.
Sorry about that. I'm operating two mice here, so sorry about that. Okay, E. Chrysler, extensively studied in a year's time. Is that safe?
Oh, yeah, you know, this is very similar to a lot of things. And like I said before, uh, you know, this vaccine situation is not something that we've just started doing with COVID. You know, we've been doing vaccines forever, and we know that if you're going to see anything unexpected, it's going to happen pretty quickly. And we have given now over 100 million shots. I mean, our statistical numbers are really just so powerful now. And if you look at the technology of the vaccine, the potential for anything is going to be minuscule compared to the real virus. And I think that's the main thing, is that any perceived unlikely risk from the vaccine is even the potential of it is far lower than the very real observed devastating effects that we've seen from the actual virus.
Thank you, Dr. Dobbs. Mr. Webster, I'm not really understanding your question. We did speak about the variants, so just write me back for an explanation of that, because I'm not sure what you're asking. So the next question, what are the components of the vaccine? Without this information, how will I know if I'm allergic to something that's in it? Dr. Byers.
Well, I think Dr. Dobbs, and I'm going to let him do this, listed the components of the vaccine early on in his presentation.
On the package insert, they have a package insert that lists all the stuff that's in it. It's three different lipid molecules. It's a cholesterol molecule, which is obviously your body's normal cholesterol. It's the RNA fragment, and then it's got polyethylene glycol, and then a couple other sort of things that are just normal stuff that's a lot less than you'd find in a pack of Doritos. Look just go to the package insert, and if you have extensive drug allergies, you can look at it or have your doctor look at it. It's published for everyone to see.
Okay, thank you. Let's see, okay. What about people that have had cancer? Finished chemo in December 2019, and I've had conflicting advice on this. Gentlemen?
Please, yes, get vaccinated. Absolutely.
Absolutely, don't.
Yeah, you're at risk. We know that it works well for people who have chronic illnesses or not. So I think even more so, definitely get vaccinated.
Okay. Um, if someone has gotten the first shot and the next tested, and then next tested positive for the virus, should the shot process start over or continue as scheduled? Now, that first vaccine does give you a good amount of protection, doesn't it? That first shot?
It does, but we've seen where folks may become infected between the first and second dose. You don't have to start the process over. You just need to be, like we talked about earlier, over that acute part of the infection. So, at a minimum of 10 days from the onset of your illness, if you become infected in between those doses, and as long as your symptoms are improving and you're fever free for at least 24 hours, you shouldn't have to uh, restart the vaccination at all. You just get your second dose as scheduled, or if it impacts those 10 days, maybe just a little bit later. But it shouldn't require you to start over.
Thank you. Mr. Webster says, you hear in the news about vaccination passports. Is Mississippi considering vaccination documentation like that? Dr. Dobbs?
It's something that's certainly, well seen in the news and discussed a lot. It wouldn't be hard for us to share that if needed, if someone wanted a vaccine passport. But that's going to be really more of a federal conversation, and so we'll be part of the team if it's beneficial to Mississippians, but it's not something that we're probably going to do independently.
From Brother Rob, what's your thinking on herd immunity at this point? We kind of talked about that, but here's the second part of it. And will vaccinating kids be necessary to achieve this goal?
Essentially, yes. Kids 18 and under make up 25% of the population of Mississippi. So, and the calculations for herd immunity are very simple. We easily understand that you really need to get probably 70, 80% of folks vaccinated. Now, I do want to say, though, I think that herd immunity in the classic concept of measles is probably not really plausible because we know people can get reinfected. Once you get measles, you don't get reinfected with it your whole life, right? But we know some people can get reinfected with COVID, so it's a little bit trickier. I think what we can get is we can get a herd effect where we don't see massive outbreaks, but I don't think we'll be able to eradicate it totally with just vaccination. But to get the most effect, we really would need to have kids vaccinated. They make up such a big part of the population, and certainly they can spread COVID.
Dr. Byers, did you want to add anything to that?
No, I think Dr. Dobbs nailed it.
Okay, the next question I can even answer, should you still wear a mask after getting vaccinated? Yes. Gentlemen, please talk about why that's important, even after you've been fully vaccinated.
Yeah, there's several reasons why. First off, the vaccine's on 100%, right? So they're pretty darn good, but we want to prevent transmission, especially in school settings, so that it makes sense. We also know that we have some variants out there, so we want to keep our guard up a little bit. Putting a piece of cloth over your face is such a small sacrifice to be able to do more, and we know it does really help. If CDC did come out with guidance, if you're in like a small social setting and everybody's vaccinated, you don't all have to wear masks, and that's great, right? We can do a little bit more. But the other thing is, it's really impossible to say who has to wear a mask and who doesn't have to wear a mask. It helps support the global effort if we all just kind of, if we're in a rowboat and we're all rowing in different directions, we don't go anywhere. But if we can all just line up for a little while and just row on past this coronavirus business, we'll all be in a lot better, a lot quicker.
Thank you, Dr. Dobbs. This is a good question too from Ms. Shay Hollingsworth. Not sure if it was covered, but how long does the vaccine last? So if we get it, how long does it cover us? Good question. Who wants to take a stab at that?
Paul, you go ahead.
I couldn't find the unmute. So we don't know exactly at this point because, the vaccine is relatively new, but we anticipate that it's going to be prolonged protection for months or longer. And I think we're seeing that now, and I think we're seeing the benefits of that. Remember that we've only been vaccinating since the middle of December, so it's going to be difficult to project how long that immunity lasts, but we do anticipate that it's going to be for a prolonged enough period to have enough people protected at the same time that we can begin to see that effect of reducing transmission.
Okay, Mr. Webster, do you expect COVID to spike or increase in the fall like the flu?
Unknown, really. I mean, and certainly we know that many coronaviruses can have some seasonality, and we can see some increases in as we get into the cooler months. It's gonna be tough to sort of predict and have that sort of view of what it's going to look like in the fall. I think we're still at a point where we're trying to project where we're going to be in the next few weeks, and we know that we're still seeing transmission in the state. So, we still need to stay pretty aware. I think it's quite possible that we could see some increases in the fall, but we're just going to have to kind of see how that plays out. I think Dr. Dobbs may have some different thoughts.
No, I agree. I mean, it's not really been seasonal like flu, so it's a different animal, really, unpredictable from that perspective.
Ms. Watts has a great question. The CDC now says that we can now stay 3 feet apart. We've seen videos showing that saliva can spray beyond 6 feet when talking. So how is 3 feet safe for us as a teacher? She's thinking about the classroom setting.
You bet. And I think that, our preference and recommendation will still be if it's achievable, that the kids in the classroom setting are at least 6 feet apart and remain masked. I think that if it's not achievable, and I know that some classroom settings when there's been more students that have had to be required to be in the classroom, that it's been harder to keep that 6 feet. Certainly, I think that's a piece that can happen, but our preference and our recommendation is, if it's achievable, to continue that 6 feet in the classroom. Just to look at the data, it certainly does look like there's less transmission in a structured classroom setting than within the other settings that can occur during school. And I think CDC's guidance is pretty clear that the 3 feet applies really only to the very strict classroom setting. And again, our preference would be, and our recommendation would be to continue the 6 feet if you can continue to do that in your school. Dr. Dobbs.
Are you good, Dr. Dobbs?
Yeah, finding the mute button. Yeah, we've had such a good experience, though. We know that I think the key thing is order versus disorder. In structured settings, when kids are wearing masks, when they're separated, they do well. So I think whatever we do, we need to make sure we keep that in mind and preserve it. Chaos is coronavirus's best friend.
All righty. Miss Formby, Angela Formby, I'm sorry, I probably mispronounced that, but she says, where can I get the package insert to see the components? I would assume you could just Google that.
I just did. And you can see the one that I have it'll be really under the FDA EUA. And this is the one for Moderna, and it has all the stuff that's in it. And it just says it's like lipids, polyethylene glycol, and then the normal lipid stuff. And then it has like acetic acid and sodium acetate and sucrose. So, pretty normal stuff.
Okay, and Dr. Dobbs, thank you for posting that link there. For both Dr. Dobbs and Dr. Byers, and I think this is very, very important, you tweeted out about vaccine parity for African Americans receiving COVID vaccinations. Not sure if you addressed this earlier. How did you reach parity and what will you be doing to keep those numbers up? Dr. Dobbs, you start first.
Yeah, so it's our partners, right? I can't say how much important it's been. We've seen phenomenal buy-in from um, the African American community in prevention. We saw pretty quickly that that it transitioned kind of strangely to a predominantly white problem because we saw better control within Black population after the spring, which was worse, and then recognizing where some of the concerns were as far as a hesitancy, addressing those head on, working with faith leaders, Black physicians, community leaders, all sorts of folks, and just answering questions. That certainly has been useful, but also making it available to folks to places where Black Mississippians want to get vaccinated. And we're monitoring early on after the first couple of weeks is what percentage of vaccine was going to Black Mississippians based on location. And so if it was a place that was meeting these disparity needs, we reinforced them with more vaccine. So a whole host of strategies through fighting hesitancy and addressing access challenges. Not that we're not done by any means, but I'm very proud of our team and of our partners for stepping up and making this really phenomenal success.
Troy, you snuck in there on me, didn't you? Let's see. Couple more questions. Big picture. Despite the challenges, was it a good decision to open the schools last fall? Gentlemen?
I think it was a success. Not that there weren't challenges. I think I really wish that we hadn't. I wish we'd approached extracurriculars in a different way. I think would be the main thing. I think it's a qualified success. Yeah, I think we could have prevented some community transmission, kept kids cool better if we had been able to convince folks to approach extracurricular activities in a different way.
All
And,
right.
and I think it's largely been a success too, because of the efforts of the schools and how many of the schools have really held a hard line and have really worked hard. And it's been much appreciated to adhere to the guidance to limit transmission within the school settings. And I think, by and large, we've seen the schools be more of a reflection of the transmission that's occurring in the community rather than a multiplier of those infections and transmission. I think, the wild card in all of that has been sort of some of the unpredictable extracurricular events, especially where parents have decided to hold a dance or some other get together, and we've seen transmission that's occurred in those settings. But by and large, the schools have been pretty successful in limiting transmission within the strictest setting in the classroom setting, and have really gone out on a limb and made some hard decisions about doing things like canceling football games when they've seen that they've had cases within their kids or cases within the school that they're going to play. And so, I think it's been some great efforts all the way around, and our schools have gained an enormous amount of experience on how to deal with COVID over these last several months.
We have a question here. I feel like we've answered it, but perhaps this individual did not hear the answer. So I'll just get you to kind of briefly repeat it. How long is the effectiveness of the vaccine that's being taken now? I don't remember which one of you guys answered that. Dr. Dubs, didn't you answer that?
Yeah, it looks like it's going to be pretty prolonged. It's not going to be like the measles vaccine, which is going to be mostly lifelong. But we do think a year and more for most folks. So maybe significantly longer. Certainly we have to wait and see for sure, but some other markers seem to suggest pretty strong prolonged immunity, a year, maybe 2 years, just based on preliminary studies.
All right. I don't see, let's see. Here we have from Melissa Hughes. I had the first Pfizer vaccine before I received the second dose. I became sick with COVID-19. I received a monoclonal AB infusion. When can I get my second vaccine? Gentlemen.
So really, this is one of those cases where the 90 days does play. And so really, we need for an individual to wait a full 90 days after their monoclonal antibody treatment for COVID-19, because we know that those antibodies may impact the development of that immunity from the vaccine. So we recommend delaying that second dose until 90 days have passed from the monoclonal antibody treatment. And even though you'll be a little bit late with getting your second dose, it will still be a valid dose.
All right, now, Dr. Dobbs and Dr. Byers, one sentence that you want to relay to the teachers as we close, the one thing you want teachers to remember above all else. Dr. Dobbs. Wait, Dr. Dobbs, you're muted.
Okay, sorry. Now's the time. Please go ahead and get vaccinated. This is where the risk is. This is going to help us get out of this. I assure you that I am as ready as anybody to be done with coronavirus.
We all are. Okay, Dr. Byers.
I would say stay the course, and keep doing what we're doing that got us here. I think the efforts that we've made along the way to continue to put in place those non-pharmaceutical interventions, those things that are not the vaccine, but we know can prevent transmission. We don't need to let those go by the wayside yet, and take the opportunity to get vaccinated. Don't wait on a particular type of vaccine. If there's a vaccine available for you that you can get, please get it.
Thank you to both doctors, and thank you to all of you out there for your great questions. Let us know if you enjoyed this, if you would like us to do future shows. We'd be delighted. On behalf of Dr. Thomas Dobbs and Dr. Paul Byers, I'm Liz Charlotte, wishing you a good day.
Thank you all.